Hello everybody, welcome back. I'm Dan, this is Dr. Tim. We're here on Dr. Tim's Pain-Free Podcast. Thanks everybody for joining us. We appreciate you sharing, we appreciate you liking us, and we hope you are learning something. What are we going to be talking about today, Dr. Tim?
Today we're going to talk about a subject that is very important because it affects so many people, and that is we're going to talk about trigger points.
Trigger point. What's a trigger point?
Trigger points are basically, simply put, it's a knot in the muscle. We all have them. We get stress. I'll tell you why we get them, more than just stress, but as we go on today, we're going to talk about, what are they, how do we get them, how can we get rid of them, and what can we do to prevent them.
That's important. We're preventing them, obviously. We always want to stay proactive, be on the front side of it, not try to be just reactive about our health. So I'm excited about today's show. Let's get it kicked off.
All right.
We'll be right back to Dr. Tim's Pain-Free Podcast.
You're tuned in to Dr. Tim's Pain-Free Podcast, educating the world about living a pain-free life. Find all our episodes on iTunes, Stitcher, Facebook, YouTube, or wherever you get your podcasts.
Welcome back. We're here with Dr. Tim talking about trigger points today. So tell me more about them. Where do they come from?
Trigger points basically are knots in the muscles, and they're an area that's kind of encapsulated so they don't get very good blood flow. Oftentimes there's scar tissue that is built up in and around those muscles that don't allow the blood to penetrate. With the blood flow comes the oxygen and washing out of waste products so that the muscle can heal. And when it's encapsulated with that knot and that fibrous adhesion type of material, of tissue, then the blood flow can't do its job, and so it just stays and it proliferates and it gets bigger. And then we get knots mainly in the upper back part of our spine that don't tend to go away with just a little massage. Yeah. And so they can get bigger and bigger and bigger. You got to do something about it.
And I hear this every day here in the clinic. People have knots. Everybody has knots.
Sure.
It comes with the desk society that we're in, right?
That's exactly it, because originally, way back when, it kind of all started with a couple of doctors that I'm going to tell you about, and they did the research, and they even coined some of the phrases that we still use today. And this happened back in the 1940s. The first one I'll tell you about, his name is Rene Callier. He's a medical doctor who basically researched in the early 1940s out on the West Coast. He graduated from USC. He wrote a bunch of textbooks on it, and he actually coined the phrase upper cross syndrome. And I'll tell you about that, upper cross syndrome. So what he found out was that when there's any sort of trauma introduced to the spine, then the result of that trauma is that we automatically begin to lean forward and we carry our head forward compared to where it should be in an upright position.
Ears over shoulders.
Exactly, right? Ears over shoulders. We know the human head weighs about 10 to 12 pounds, and for every inch of head forward posture that we carry, as I'm illustrating it here for those who are watching, I'm pushing my head forward. For every inch forward, it increases the weight on the neck and upper back muscles by 10 additional pounds. So a 12-pound head, that could weigh 32 pounds with just a couple of inches of head forward carrier. And then you're looking at the person who, sits at a desk and works at a computer all day long, and their posture is off and their head is forward.
Or the kid who's
sure, yeah. The kids and their posture is a big thing with the introduction of all the games and society into society with the cell phones and the iPads and even little kids. It's like to keep them quiet, we give them a game to play, and their head goes to that screen. So it's not just the workforce, but it's young and old. And we all know someone who walks around in their late 70s or 80s whose head is way out the front, and they're maybe on a walker and they're not even bending and moving like they should. And their head at that point could literally weigh, in relation to these muscles, 50, 60, 70 pounds. That's why they can't stand upright, because they've wasted all these muscles over time deteriorating because they're just holding on.
So what's the cross part?
Okay, so upper cross syndrome says that, Rene Callier said, when you have trauma, you lean forward and you start this vicious cycle. It's like a catch-22. And so the cross comes from when you're looking at the side of a person and measuring their posture. And you see that the head is going forward. It usually goes forward as a result of weakness of these deep muscles inside the front of your neck and weakness down between your shoulder blades. And that weakness lets the body go even further forward, which causes these muscles on the upper part of the back and the lower part of the front thus making the cross from the side, to get real tight. And so you've got this tightening, pulling the shoulders forward, and you got this tightening of the upper back muscles trying to hold the head up, and then you got weakness in the front and weakness in the lower part of the back, and that's just a cycle that you start going down where these muscles on this plane are weak and these are tight. And the tighter they go, the weaker they get. The weaker they get, the tighter they allow it to go. So upper cross syndrome is just a phrase that was coined again by Rene Callier in probably the 1940s, late 1940s, after his research. But again, he said it goes all back to some sort of trauma. You have trauma, and that pain and inflammation in the back side of your joints causes you to want to unload that pain and pressure, so you start to lean forward.
And trauma, like a car wreck?
It could be a car wreck. It could be, that when you think trauma, you think something catastrophic. Yeah. But again, it could go back to just the micro-repetitive trauma as well, where you're sitting at a desk in the wrong position for an 8 to 10 hour day for a 10 or 15 year career, or a student in school who's always head forward, and then they lose the strength of those muscles to hold them in that upright position, and it just starts the process going forward. So then you introduce another doctor. Her name was Janet Travell, and she's famous too because Janet Travell is the first female to ever be the personal physician of a sitting U.S. president. She was President Kennedy and President Johnson's personal physician there in the White House.
And Kennedy had lots of back problems and issues, right?
Absolutely. The story goes, I mean, it's before my time, but you read about him and you see that he tried to play football when he was in college, and he had a back injury. And so he quit football, and it wasn't a severe debilitating back injury, it was just an injury, but then he joined the Navy. And while he was a Navy, U.S. Navy shipman, the story goes that the ship that he was on was a smaller one, and it got ran over. Literally, a bigger ship ran over him on the ship, and it caused him to have some major back issues, lower back pain, and he had surgery as a result of that. So then as he's campaigning and getting into politics later on in life, Janet Travell comes along, and she was the one who was writing about trigger points in the 1940s, and she started doing some treatment on him to help him with those trigger points in his back. And her research basically says that there are two types of muscles. Now oftentimes you might hear those referred to as like fast twitch muscles versus slow twitch muscles, right?
Long
so
term, short term.
Long muscles versus short, yeah. And so when you look at the postural muscles that run up and down your spine, and they're really thin, they're about as thick as your pinky finger, they're running basically vertically, opposing the gravity as our body starts to pull forward. They are the ones that are holding us upright. They're actually called the erector spinae, which is Latin for keeping your spine upright. That's all they do. Well, the characteristics of those postural muscles say that they're easier to injure, but they're stronger than the other muscles around. So she researched that phasic muscle versus postural muscle. Now, phasic is the opposite. Phasic is the fast twitch, the one that goes through all the different phases of contraction.
Gives us motion.
That's right. So like if you work out at the gym and you lift weights and you do reps, those repetitions are working phasic muscles. And they're easier to damage and they're weaker. Excuse me, they're harder to damage, but they're weaker. Right? Okay. So it's catastrophic if you are lifting weights and you tear your bicep. Yeah. I mean, it's hard to injure those. Well, if you get hit in a rear-end collision, it's easy to damage the postural muscles. So you have these two opposing types of muscles that are designed to do different things. The postural muscles are designed to hold constant tension, and they just keep your body upright. I mean, if you think back to college and when you pulled an all-nighter, you maybe sat at the IHOP all night studying for a test the next day, and the next day your head is wanting to bob off. But it took 20 plus hours for those muscles to fatigue. But if you had, say, that equivalent of your 10 or 12 pound head being held out in front of you by your bicep and shoulder muscle, which are phasic, not designed to hold tension, just to bend, you couldn't do it. You'd begin to shake and it would wobble and you'd fatigue it. So those muscles fatigue. But when your head goes forward after you're unloading from that trauma, that Dr. Callier talked about. He said basically you're causing one set of muscles to fatigue, recruiting the other type of muscle to now do the job that they're not designed to do.
Gotcha.
So the phasic muscle now begins to hold constant tension. And the way it does that, and as opposed to fatiguing and giving out, it starts to lay down scar tissue. And that scar tissue that you feel in the traps and the upper back muscles where someone gives you a good deep thumb massage in your shoulder blades, feeling all those knots, they're there because the head is forward and the postural muscles are giving up. So they're asking for help.
So that's the result as a trigger point.
That's exactly it. That fibrous adhesion makes a trigger point in those phasic muscles.
Because you basically got the long-term muscles. They keep us up, and we can do that. We can stand up or sit up all day long.
Right.
But if they quit, we would ragdoll. Right?
That's right.
And so now the short-term muscles are trying to become like those and stay contracted.
That's exactly it.
And they just can't do that.
They can't. Physiologically, they're not designed to do that. So they must lay down tissue.
They get cramps and pains and knots and spasms and all
That's
those,
right.
and trigger points.
There is the trigger point.
Okay, that makes total sense. So I'm sure everybody out there now is trying to feel around and figure out if you got them. You probably got them. Well, that's one of the things we do here is treat them. So let's talk about that in our next segment. How do you treat them? And then we'll talk about how you can totally avoid them. Thanks for joining us on Dr. Tim's Pain Free Podcast.
Thanks for joining us on Dr. Tim's Pain Free Podcast. Help us spread the word by sharing this show with your friends and family and posting to your social media. Now back to the show.
Welcome back. We're talking about trigger points. We've talked about what they are. We've talked about what causes them in the long term. So can you do anything about them?
Sure. Actually, we like to talk about fixing them, and the way you fix them is based on the work of that second doctor I mentioned, Janet Gravel. She uses, back in the 50s, she was using a straight saline injection. So basically what she determined was that since it's a fibrous, knotted ball of tissue underneath the skin, that the only way to truly make it dissolve and go away was to use a very small gauge needle and put that saline inside of that muscle knot. She didn't use any medicine. Salt water. And she would expand the capsule with enough fluid. It's like blowing up the balloon, the water balloon, and it eventually burst the balloon, the sac.
Yeah.
And so she's putting that in there, and she would even do some star patterns where she would spread the fluid out and make channels, and as she withdrew the needle, the syringe, she would leave the channels behind, and so blood flow could then penetrate in there more easy. It's basically like the matted hair on the back of a stray dog. You can't comb through it, right? Well, that blood can't get through that tangled mess of scar tissue, and so you leave some channels behind with the needle and you fill it up with that fluid already. Then the blood flow comes through there and it wafts all of that waste material out, and it brings life back into that area. And sometimes, you know, she would say that it takes about 3 to 4 trigger points, depending on the size of the knot, to break it down completely.
Okay.
Yep. So she was doing that treatment on Kennedy, actually in the Oval Office, according to the memoirs you read. She injected him in the Oval Office because his back was so jacked up after his surgery, and the muscles and the scarring and all that. So she was helping break that down and keeping him upright so he could be president and campaign without a wheelchair, you know.
Yeah.
You know, that being said, those protocols that she started in the 50s, we still use much of them today in physical medicine. We've changed a little bit with some technology because now we use a very 0.5% lidocaine solution, which 0.5% lidocaine means that it's 99.5% saline, what she used. But saline stings a little when you put it in a syringe.
Salt water
It's kind of like, oh, that hurt, but it's going to break down if you can endure that. Well, now with the numbing agent of lidocaine, you don't feel it. So they numb the area. And it's similar to what you get done if you go to the dentist and have a tooth worked on and they numb you up. That's the similar, they use maybe a Marcaine product, which is like a longer lasting numbing. But how we treat trigger points now in the office is we first identify them, and then we put them through a protocol of about 3 or 4 injections into the same area. Sometimes as we put the solution into that trigger point and expand that capsule enough to break it down, other areas start to flare up. So oftentimes it may lead to a more central area of like, this is why I came in, this is what I feel every day, but as that starts to go away, it's almost like peeling the layers of an onion back. There's another one and you go, wait a minute, my lower trap or my lats or my rotator cuff muscles that have been stretched forward for so long are now starting to show signs of being knotted up. So we work those areas as well. But usually it takes about 2 to 3 of the injections spread out over 2 to 3 weeks. You can't do them more than every 7 days. And you know, the beauty in all that is that it's pain-free. Even people that are scared of needles and say, I would never get an injection, usually what they say in our office, over 90% of them, after we've convinced them and showed them and educated them and told them it's not going to go away without them, and are tired of seeing them suffer, they do one and then they say 2 things. One is, it didn't hurt as much as I thought. And 2, I wish I would have done it sooner.
Yeah, should have done it sooner.
That's right.
Yeah, and people will try to massage them out too, right?
Sure, and feasibly that can be done, but it's just such a slower process. And you know, if you truly want to get rid of the trigger point, you actually have to remove the cause of the trigger point. And like we talked about the head forward posture, you can get a massage all day long. And then when you stand up off the massage table and go back to your desk or go to work the next day or sit in traffic and you're back in that head forward posture, then you're just causing your body to recruit and build new scar tissue trigger points that you've just tried to work on and get rid of. So, you know, massage does bring in blood flow. And, you know, when you do a real specific, like stripping of the scar tissue type of myofascial release therapy or deep tissue massage, sometimes it's called, then those are a little bit more beneficial than just the feel good. But you could get feel good massages every day and never really get to the root of the problem, which is the head forward posture and the knot built up so much that it's going to take more than just kind of rubbing over it.
Yeah, you feel relaxed, but then an hour later, because you're back in that head forward posture, this thing's cramped up again just like it was before.
That's exactly it. You don't remove the initial cause.
Massaging them the hard way, flush them. Sounds like flush them out of there.
That's right.
Put enough fluid into it.
That's right. And insurance covers 4 trigger points in one muscle knot or in one trigger point area. And so that's the beauty of it. You know, we all want to try and use our health insurance to our benefit, and sometimes we don't know how. We don't realize that this is even out there. We don't realize that we realize we have knots, but we don't know how to get rid of them. We might join a club that does massage on us every month, but it doesn't really fix the problem, and we're paying out of pocket for that. Whereas you can go get a proper diagnosis in a physical medicine clinic that can then incorporate a treatment plan that has some deep tissue work in it called manual therapy. And our manual therapists that are at this clinic, they do great, mighty fine work with their hands, and they can help facilitate spreading that fluid out after we've gotten the injection, putting all of the fluid in the right place and expanding that capsule. Then they work it, and so in conjunction, massage actually helps if it's done properly.
And it kind of brings us back to what we talked about in our last couple of podcasts, the integrated model that we have here at Trinity Integrated Medical. It allows each person to play their role. So you got the person who is our nurse practitioner, and she would inject those trigger points.
That's right.
And you got the massage therapist, the manual therapy, who's working on them as well, trying to bring in more blood flow. And then you got the chiropractor. What does the chiropractor do?
Chiropractor is really the one who's training the body to be back in that better posture. So when the head goes forward, oftentimes you lose the curve that we should have in our spine. You may not think about it, but if you really think about it, you think of a picture of a spine. It's not just a straight up and down bone. From the front it is. If it's not, that's considered scoliosis. But from the side, it has all these S's. Those are primary and secondary curves that we develop. Primary we're born with. Secondary we develop after we've been moving around and bending and lifting and twisting and holding our head up and going from crawling to standing and walking and that sort of thing when we're a toddler. And so those secondary curves, we start to lose those. And the only thing that we really know of that can help restore them is the chiropractor and the chiropractic adjustment. He can go in and put those movements back in there in a proper way. And obviously you don't try it at home because you don't know exactly what you're doing when you adjust yourself, but the adjustment is a hands-on thing or an instrument thing or a specialized table that has some moving parts on it, all designed to put that curve back into the spine so that you can actually, you know, if you if you go through a corrective care program with a chiropractor, and you would see that you start oftentimes with a very straight neck on an x-ray, and then within a few months, it can undo a few years worth of bad posture, and you can start to see that curve restore.
And those curves, we need them. They're the shock absorbers.
That's exactly right.
You jump, you step off a curve, that's the bounce.
That's exactly right. Yeah. You think about a suspension bridge that's hung out over two mountains, and you're going to drive over it. And you look underneath it and the structure, oftentimes it's big, giant archways. And those curves are the strongest way to hold that bridge up. And so it goes back to, engineering and physics, and God knew what he was doing when he put our curves in, because he knew we were going to walk around 10,000 plus steps a day, and we wanted to be a spring that goes along on every step as opposed to a stick that would wear those joints out much, much quicker.
Yeah, if it's straight, every single step, you're putting a lot of pressure into the disc, right?
That's right.
So you can just flatten those discs out really quick.
That's right. Well, discs are not even designed to be weight-bearing. The weight-bearing part of the joint should be the facet, but when we go forward, when we lean and unload those facets, back to the very original reason why we get them. Yeah. You unload those facets, and now you're putting all that pressure on the disc, and you are more like a stick walking along that's bouncing on the discs. People say those are the shock absorbers. Those are the secondary shock absorbers. You shouldn't put any pressure on it at all. You should be a curve bouncing along, putting the pressure back on the facet joints, actually.
And when we do that, that's a great segue. When we do that, that's how we really prevent them.
That's right. If you show me a person with incredible posture that's even into their 60s, 70s, and 80s in life, then I'll show you a person that doesn't have a whole lot of trigger points. Okay. On the flip side, a person who could be only having dealt with this for a couple of years, not an old person, but a person that just has bad posture and they sit slouched all the time. And I'll show you a person with trigger points. Because the body, it's no respecter of person. It doesn't say, oh, you're old, you're going to get them. It's all based on how you hold yourself. And a young person holding themselves in the wrong position will develop trigger points as quick as an old person.
Yeah, I have a lot of patients that come in and they say, oh, I carry my stress here. But when we look at the x-ray, most of them carry their head here.
That's right.
And that's really what's putting us, you don't even get to pick where we put our stress. Wish we did, but we don't.
That's right.
So it's all related to the trigger point.
That's right.
All right. Hopefully you learned something today. I think it was a great show. I enjoyed it. I enjoyed learning about it.
Yeah, good stuff.
Yeah, so share this podcast, put it out on your social media, let your friends know. Anybody who's interested in pursuing better health and living a pain-free life, they can find us right here on Dr. Tim's Pain-Free Podcast.
Can I add one more thing?
Do it.
Okay, so I just want to say we put our phone number up here. If you have any questions about anything, reach out to our clinic. I'm available during normal business hours. If you call on at midnight, I won't. If you're watching this late, but or watching listen to our podcast on your early drive in to commute. But yeah, give us a call. Give us suggestions in the comment boxes below all of these videos that you can watch online. Tell us what you want to hear about. Tell us your situation. Reach out for help if you have questions about what can you do. We got lots of more episodes coming up where we're going to cover a vast array of topics, including more functional movement, more specifics on chiropractic, how it got started. We're going to talk about stem cell therapy and regenerative medicine, which is just a phenomenal thing that's happening right now. Probably the biggest breakthrough in all of our lives, our lifetimes, is the invent or the discovery of a natural stem cell injection therapy. And we do that here in the office as well. So any of those topics that you have that deals with pain, post-surgical pain, post-rehab pain, post-traumatic pain, fill it in, ask questions, and we'll get to it and we'll answer your questions.
Yeah, looking forward to it.
Appreciate you.
Thanks for joining us on Dr. Tim's Pain-Free Podcast. While I make every effort to broadcast correct information, I'm still learning. I will double-check all of my facts, but realize that medicine is constantly changing. One doctor may have a different way of doing things from another. I am simply presenting my views, and the opinions are solely of my own. I welcome any comments, suggestions, or correction of errors. I take no money from drug or device companies. By listening to this podcast, you agree not to use it as medical advice to treat any medical condition in either yourself or others. Please consult your own physician for any medical issues you may be having. This entire disclaimer also applies to any guests or contributors on the podcast. Under no circumstances shall Tim Uselton, DC, Dr. Tim's Pain-Free Podcast, or guests or contributors to this podcast, or employees, associates, or affiliates of this podcast be responsible for damages arising from the use of this podcast.